Assalamu alaikum. I'm Dr. Muhammad Shoaib from PIMS, and Dr. Akhtali Bandesha wanted to discuss the topic to get the input from the esteemed panelist and the honorable guests. So we start the topic of climate change and cardiovascular disease. Climate change refers to long-term shifts in temperature and weather patterns, and it is caused by solar activity and large volcano eruptions on which we don't have any control, but on human activity we have control, and we are producing a large amount of greenhouse gases which are causing global warming. So sequelae of global warming include changes in rainfall patterns. Some areas get severe rains and frequent storms, which lead to flooding and landsliding. And the other areas get less rain and droughts. They lead to water scarcity and malnutrition. And there is increased incidence of wildfires, which further increase in greenhouse gases. And there is also, because of all this, there is also heat-related illnesses, and there is difficulty in travel and work environment, which increase the disease burden, especially the cardiovascular disease burden. So the climate is altering the Earth's global land and ocean temperatures. 1 degree centigrade increase in global mean surface temperature was observed in the last decade. Greater than 70,000 deaths in Central Europe were attributed to hot weather in 2003 heat wave. And you can imagine the burden of the global warming, that 220 million heat exposure events were recorded, more as compared to the average events in the last 25 years. And in 2019, 0.54% deaths and 0.46% disability adjusted life years were due to raised temperature worldwide. And the heat-related mortality expected to be tripled in 2030 and 2050. So we have to alter the process of climate change. The impact of climate change on cardiovascular disease is by 4 factors. The most important is air pollution, followed by heat exposure, then eco-anxiety and climate change-related weather disaster, and climate change-related spread of vector-borne diseases. So this slide will summarize these. First, we will talk about the heat exposure. It will cause heat strain and heat stroke, and it will cause increased incidence of heat stroke in population who are at high risk, like hypertensives, diabetics, and patients who are having chronic kidney disease because of their disease and the medication they are using. Then there is the psychological factor, like eco-anxiety. Exposure to climate change related to weather disaster lead to generalized anxiety disorders, schizophrenia, and specifically Takotsubo cardiomyopathy can be due to the stress of disaster. Then the climate-driven spread of vector-borne illnesses. In Pakistan, we are facing the surges of dengue fever, malaria, while in other countries, like they face the spread of Lyme disease, babesiosis, and Chagas disease because of climate change. Then, most importantly, there is the role of air pollution, which cause endothelial dysfunction, then systemic inflammation, prothrombotic pathways activation, autonomic imbalance, and ultimately it causes metabolic syndrome, which further cause hypertension, diabetes, dyslipidemias, and ultimately leading to the coronary disease, calcifications, carotid intimal thickening, leading to stroke. So the factors contributing to cardiovascular risk of climate change. The climate change causes global warming. This increases the frequency of heat events, which are due to the air pollution, and the effect of heat events are more on vulnerable population, like elderly, for those who are in low socioeconomic status, and those who are having premorbids like diabetes, chronic kidney disease, and all these will ultimately cause increased cardiovascular mortality. So we'll briefly discuss air pollution, contamination of indoor or outdoor air by chemical and physical biological agents that modify the natural characteristics of environment. It has three main components. Primary components are formed of gases like nitrogen oxide, sulfur dioxide, carbon monoxide. Secondary by tropospheric ozone, and the most importantly, the particulate matters, which are caused by combustion, organic molecules, metal particles, and second-hand smoke. And especially the particulate matter 2.5 is the most important. Disease burden due to air pollution in 2019, 11.8 deaths, around 9 million deaths were due to air pollution worldwide, and out of which 6.19, around 5.8 million, were related to cardiovascular deaths. And the short-term increase in air pollution causes about 1 to 3% increased relative risk of acute MIs. And long-term exposure to air pollution causes around 10% increase in cardiovascular events. So this is the pathogenesis. The air pollution causes its local effects in the lungs, and as well as in the systemic circulation by causing oxidative stress, which cause autonomic imbalance, which cause endothelial dysfunction. It causes hypothalamus pituitary axis activation. It causes systemic inflammation, and it causes prothrombotic states. And these all lead to increased adhesion molecules. They increase platelet activation. And by this, the NOS uncoupling lead to increase free radicals, and the other pathways lead to increased smooth muscle activation and low-grade systemic inflammation, which ultimately lead to cardiometabolic syndrome and increase the cardiovascular risk burden. So this is the contribution of air pollution as compared to the other risk factors. Air pollution is second to tobacco smoking in causing mortality. And this is the depiction of particulate matters. Particulate matter 2.5 means that 2.5 micron size is the most important component of air pollution, which is causing you can see in this heat map. Like we are living in the area of the most air polluted area, just behind India and Bangladesh. So 90% of the global population breathes air pollution at level that exceeds WHO standards. And you can see that many European states, many US states are far behind the WHO standards. And this slide gives three important messages. Like you can see that there is steep increase in the mortality with increase in pollution, then followed by a plateau. So if we do the so if we work on the later stage of the graph, it doesn't decrease the mortality. So we have to work very hard to bring the graph to its initial state, so that any decrease in air pollution can decrease in cardiovascular mortality. And you can see that WHO standard, annual standard is at IT4 interim target of 10 micrograms per cubic meter of air pollution. And it has also a 24-hour target, which is interim 25. So exposure response relation of short-term effect of PM 2.5, you can see that there is a steep increase of mortality with the increase in air pollution. And this is the effect of the chronic effect of air pollution. And you can see that the ozone has the permissive role. Like if there is same amount of same concentration of air pollution, the areas which are having high ozone will have more cardiovascular mortality. The ozone is tropospheric, it's not stratospheric ozone. So two factors contribute in this. Then this is the cardiovascular disease prevention in era of climate change. We have to assess the patient, his or her socioeconomic status, comorbidities, psychiatric illnesses, access to air conditioning, proximity of major highways, exposure to heat, and with labor or exercise and general fluid intake. Then antiplatelets have a dual role. They hinder the biological cooling mechanism. At the same time, they decrease the prothrombotic states. And the increased pollution has some effect on increased incidence of atrial fibrillation because of dehydration. So the blood pressure antihypertensive medication will increase the risk of heat stress, hypovolemia, and acute kidney injury. And hypercholesterolemia is associated with impaired cooling mechanism, and statin, they prevent this. And they also have certain anti-inflammatory actions which prevent the cardiovascular disease due to air pollution. And then tobacco, cigarettes, nicotine ingestion cause physiological stress and during heat exposure. Then diet, adopting a plant-based diet co-benefits the patient health and decrease the energy expenditure on meat production. Meat production increases a large amount of carbon dioxide, and also a large amount of energy is required, so it increases the global warming. Then the exercise, utilizing active transportation methods like cycling, walking, has dual benefit of increased physical activity and decreasing the greenhouse gases by decreasing combustion. And then those with heart failures are at particular risk for heart stress, heat stress, both as a result of their underlying cardiomyopathy which decreases the heat stress tolerance, and medication prescribed with increase the risk of heat stroke, dehydration, and acute kidney injury. And in the last, inadequate sleep during duration is an important cardiometabolic risk factor. And it also has dual effect, like if the patient is sleeping more, he will consuming less electricity, he will consuming less petrol, and so decreasing the air pollution. High impact actions, fly less, drive less, or use a more efficient car. Eat a plant-based diet, be less wasteful with food, make your home more energy efficient, dress and shop sustainably, consider having fewer children, consider choosing carbon-friendly pets. The pets have carbon footprints. So if we have smaller pets, it decreases the carbon footprint. Then when a patient presents with a complication of climate change, we have to tell him that if he's having syncope, it's because of heat, acute kidney injury due to hypovolemia, asthma or COPD flares due to worsening air pollution, myocardial infarction or heart failure exacerbation due to particulate matter or wildfire smoke exposure, so that he can rectify in future. I have less time just enumerating the interventions, putting face mask, reducing in traffic exposure, reducing in home penetration of outdoor air pollution, and lifestyle changes. Thank you.